Innovation's our business, and it's innovation to improve the experience and outcome of people with medical conditions.
Optasia is a company founded to extract clinically relevant information from medical images, and particularly it's with regards to conditions that affect an elderly population. Frightening statistics to do with the ageing population. So in the UK, there are now more over 60s than under 16s. As folk get older, they experience multiple chronic conditions, and yet we have a healthcare system that's not different to anywhere else around the world in that it's siloed disease areas, and yet as people get older they get more and more conditions. So Optasia is specifically about helping to identify patients with multiple chronic conditions. The Spine Analyzer has been designed to help a qualified medical practitioner in both their assessment and reporting of vertebral fracture. So it's quite well documented by folk like the International Osteoporosis Foundation and others that even when you're explicitly looking for vertebral fractures, they're not always found, and when they are found, they're not always reported clearly. So unless you report fracture as fracture, then the patient, when that message gets back to the GP, back into primary care, there's not always a clear reason to initiate treatment, for example, or falls prevention or whatever. When you have these images in the hospital systems, then actually you can mine them for other conditions such as osteoporosis, and that's where we see, particularly as the population gets older, that's where we see a real value in Spine Analyzer. Osteoporotic fractures are very common. It's estimated that 1 in 2 women over the age of 50 and a quarter of men will have an osteoporotic fracture in their remaining lifetime. Vertebral fractures in particular are the most prevalent, and yet they're the least diagnosed. So aside from the fact that they're a large risk factor for future fracture, it's estimated that approximately 1 in 8 women over the age of 55 will have a vertebral fracture, so postmenopausal women over the age of 55, and that's obviously a huge number. Now most of those are asymptomatic, they don't present clinically, so you may have a little height loss, but largely they go unnoticed. About 2/3 of vertebral fractures go unnoticed. So although asymptomatically you may think, well, that if there's no clinical symptoms, why is there the need to treat? But because they confer this increase in risk just as much as a clinical vertebral fracture, it's important to recognise them and use them as a trigger for intervention to reduce your future fracture risk. So there is a problem. The International Osteoporosis Foundation and others recognise it, that there's an inconsistency of reporting of vertebral fractures, particularly from obviously the radiology department. So there are training courses that are there for radiographers and radiologists to learn to be more standardised in the way that they report. With Spine Analyzer we have a standardised report which will pick up on criteria that the user has set, and when certain criteria are met, it will report fracture as fracture, which is an important thing to do in order to then appropriately treat the patient afterwards. So standardisation is very important, and we hope that we can play a role in that. Heard about the Accelerator programme by attending a BioNow Launchpad event. We're one of BioNow commercial members, and so we attended this Launchpad event, and one of the speakers was from the Greater Manchester AHSN, and she was talking particularly about procurement and the NHS, and that she also mentioned that the AHSN has what they call their Innovation Nexus. So that's a portal to, as a company, to state what help you're looking for from the AHSN as an SME. And from filling in that form, we met with a member of the AHSN, and then through that relationship, they talked about the Accelerator programme, which we hadn't heard of before. We were invited to apply, and then we did, and were successful. So we're pleased to be part of that, and it's an interesting experience working with them, and a very fruitful one as well. So we're looking for sites, a single site, which we can deploy our software or our service in order specifically to help us work out some of the assumptions that we've had to make at the moment about the value that our offering has. And the idea would be that at the end of, we'll call it a pilot, if you like, then we would actually have some facts rather than just best educated guesses. So very much the Accelerator programme actually allows us to, in working with the AHSN, to get into those sites, to initiate those communications, and then to set up meetings and give us a chance to talk about what we do. And then we hope in a quite short amount of time that we'll be able to look at actually holding a pilot at this site.